Uber passengers always complained about the same driver. He drives too fast to hospitals, like he's in some kind of emergency. They thought he was just reckless. Until that Tuesday night when a passenger clutched his chest, gasped, "I can't breathe," and collapsed in the back seat. What happened next revealed why this driver always knew exactly which hospital to rush to and how to keep someone alive on the way there. Welcome to Forgotten Voices. Before we begin this incredible tale of hidden medical expertise and life-saving instincts, tell me in the comments what city are you watching from today. And if you believe stories like this deserve to be heard, hit that subscribe button and help us honor the everyday heroes driving among us. Dr. James Martinez had been driving for UberX for exactly 2 years, 4 months, and 16 days. Not that he was counting, but when you've spent 15 years tracking patient vitals and medication schedules down to the minute, precision becomes a habit that's hard to break. His profile photo showed a man in his early 40s with kind eyes and graying temples, smiling in that professional way that medical providers perfect, warm but controlled, reassuring but not overly familiar. The name displayed simply as Jim, no mention of the MD degree gathering dust in a storage unit, no reference to his former position as head of emergency medicine at Chicago General Hospital. James drove a silver Toyota Camry that he kept immaculately clean, both inside and out. The interior smelled faintly of the hospital-grade disinfectant. He couldn't help but use another habit from his medical days. In the glove compartment, hidden beneath registration papers and a city map, sat his old stethoscope, told himself. He kept it there for emergencies, though he'd never used it in 2 years of driving. His passenger reviews were consistently 5 stars, but they came with curious comments. Great driver, but why does he always take routes that pass 3 different hospitals? Super nice guy, though he asks a lot of health-related questions. Are you feeling okay? Any chest pain? When did you last eat? Weird but harmless. Fastest route to the hospital I've ever seen. He knew shortcuts I didn't even know existed. Who stays incredibly calm in stressful situations. Even when I was running late for surgery and freaking out, he was completely composed. What passengers didn't realize was that Dr. James Martinez was fighting 15 years of medical training every time he got behind the wheel. When a passenger coughed, he automatically assessed for respiratory distress. When someone seemed pale or sweaty, he checked their mental status through casual conversation. When anyone mentioned pain, his mind immediately began running through differential diagnoses. The hospital routes weren't coincidental. They were muscle memory from years of racing ambulances through city traffic, knowing that seconds could mean the difference between life and death. The health questions weren't nosiness. They were triage assessments disguised as friendly conversation. 3 years ago, Dr. James Martinez had been at the top of his profession. Emergency medicine was his calling, his passion, his entire identity. He lived for the adrenaline rush of trauma cases, the intellectual challenge of complex diagnoses, the satisfaction of snatching lives back from the edge of death. His colleagues respected him, his residents worshipped him, his patients trusted him with their lives, and he rarely let them down. In 15 years of emergency medicine, he had saved thousands of lives and earned a reputation as one of the finest emergency physicians in the Midwest. But success in emergency medicine comes with a cost that nobody talks about in medical school. The stress of life and death decisions every single day. The weight of carrying other people's worst moments on your shoulders. The sleepless nights, replaying cases where you couldn't save everyone. The gradual erosion of your personal life as the hospital demands more and more of your time and energy. James had handled it all for years, until the case that broke him. 80-year-old Emma Rodriguez had come into the ER on a busy Friday night, brought in by her frantic parents after she complained of stomach pain. The symptoms were vague: nausea, mild fever, general malaise. It looked like a routine case of viral gastroenteritis, something any emergency physician sees dozens of times each week. But James was exhausted. He'd been working 16-hour shifts for 3 straight weeks, covering for a colleague who was out on medical leave. He'd seen 47 patients in the past 12 hours, including 2 heart attacks, a stroke, a drug overdose, and a car accident with multiple trauma victims. When he examined Emma, he noted her symptoms and vital signs. Everything seemed consistent with a minor stomach bug. He prescribed fluids, rest, and follow-up with her pediatrician if symptoms persisted. The family went home, reassured by his confident diagnosis. 6 hours later, Emma was back in the ER, this time brought by ambulance. Her condition had deteriorated rapidly, and by the time she arrived, she was in septic shock from a ruptured appendix that had been missed on the initial visit despite aggressive treatment and emergency surgery. Emma didn't make it. The appendicitis had been atypical in its presentation, the kind of case that even the most experienced physicians sometimes miss. The family didn't blame James. They understood that medicine isn't perfect, that doctors can't save everyone. But James blamed himself. He had reviewed the case hundreds of times. The presentation had been subtle, the symptoms nonspecific. Another physician might have made the same call. The hospital's mortality review committee found no fault with his clinical judgment, but none of that mattered to James because a little girl was dead, and he had sent her home. The lawsuit came later, though it was ultimately dismissed. The psychological impact, however, was devastating. James began second-guessing every decision, ordering unnecessary tests, keeping patients longer than needed. His confidence evaporated, replaced by paralyzing anxiety about missing something important. After 6 months of counseling and medication failed to restore his confidence, James made a decision that shocked everyone who knew him. He resigned from the hospital, let his medical license lapse, and walked away from medicine entirely. His colleagues tried to talk him out of it. His family pleaded with him to reconsider. But James was done with being responsible for other people's lives. He was done with the weight of life and death decisions. He wanted a simple job with simple responsibilities, where his mistakes wouldn't kill anyone, so he started driving for Uber. For 2 years, James convinced himself that he was happy with his new life. The work was simple: pick up passengers, drive them safely to their destination, provide friendly customer service. No life and death decisions, no malpractice liability, no sleepless nights wondering if he'd missed something crucial. He told himself he enjoyed the freedom, the variety of people he met, the lack of stress. He ignored the fact that he still unconsciously assessed every passenger's health status. He pretended not to notice that he felt most comfortable driving near hospitals. He convinced himself that the stethoscope in his glove compartment was just a memento from his old life, not a safety net he hoped he'd never need. But deep down, James knew he was running from who he really was. Every time a passenger mentioned a medical problem, every time he drove past Chicago General Hospital, every time he heard an ambulance siren, something inside him stirred, a combination of longing and terror that he couldn't quite suppress. His passengers had no idea they were being driven by one of the city's former medical elite. They saw a friendly, professional driver who happened to ask a lot of health-related questions and seemed unusually knowledgeable about hospital locations. The irony wasn't lost on James that he was still helping people, just in a different way. He gave rides to hospital employees getting off late shifts. He drove anxious family members to visit sick relatives. He transported patients to follow-up appointments, often providing more emotional support and health advice during the 15-minute ride than they'd received during their actual medical visits. But he wasn't practicing medicine. He was just driving safe, simple, uncomplicated driving where nobody's life depended on his clinical judgment, until the night when someone's life did. Tuesday, November 15th started like any other night. James logged into the Uber app at 6 p.m., just as the evening rush was beginning. His first fare was a routine airport run, a business traveler heading to O'Hare for a red-eye flight to Los Angeles. The passenger, Michael Chen, was a 52, an investment banker who climbed into the backseat already, talking on his phone about quarterly earnings and market projections. He was well-dressed, professional, clearly successful, the type of high-stress executive James had seen countless times in the ER, usually brought in by ambulance after their first heart attack. As they pulled away from the downtown office building, James automatically began his usual passenger assessment. Michael was slightly overweight, probably around 220 pounds on a 5 feet 10 inches frame. His face was flushed, which could be from the cold November air or from stress. His breathing seemed normal, though he was talking quickly and gesturing animatedly during his phone conversation. Airport right, James confirmed, making eye contact in the rearview mirror. Michael nodded without breaking from his phone call. Yeah, Terminal 1, United Airlines. And I'm running late, so if you could step on it. James had heard that request thousands of times. He accelerated smoothly into traffic, taking his usual route toward the highway. The drive to O'Hare would take about 45 minutes in current traffic, plenty of time for Michael to make his flight if they left now. About 15 minutes into the ride, as they merged onto I-90 West, James noticed that Michael had ended his phone call and was leaning back in the seat, breathing heavily. "Everything okay back there?" James asked, his medical training automatically kicking in. "Yeah, fine," Michael replied, but his voice sounded strained. "Just tired. It's been a long day." James glanced in the rearview mirror again. Michael's face had gone from flushed to pale, and there was a thin sheen of sweat on his forehead despite the car's air conditioning. "When's the last time you ate something?" James asked casually, the question automatic after years of taking medical histories. "I don't know, breakfast maybe. I've been in meetings all day." Michael's breathing was becoming more labored. "Is it hot in here? Can you turn up the AC?" Every alarm bell in James's medical mind was going off, but he tried to stay calm. Pale, sweaty, nauseous, hadn't eaten all day. These could be signs of hypoglycemia, dehydration, anxiety, or any chest pain, James asked, trying to make it sound like casual conversation rather than a medical assessment. "A little," Michael admitted. "Probably just heartburn from too much coffee. I've been running on caffeine and adrenaline all week." That was when James saw Michael clutch his chest in the rearview mirror, his face contorting in pain. "I can single quotes T. Michael gasped, leaning forward. "I can't breathe." And then he collapsed against the car door, unconscious. For a split second, James's mind went blank. This was exactly the kind of situation he had sworn off when he left medicine. a life-and-death emergency where his decisions would determine whether someone lived or died. But 15 years of emergency medical training don't simply disappear. Even when you're driving an Uber instead of working in an ER, his medical instincts took over before his anxiety could paralyze him. James immediately pulled off the highway at the next exit, his hands steady despite his racing heart. He'd done this dozens of times before, managed medical emergencies while simultaneously coordinating transportation to the hospital. The difference was that now he was the transportation sir. "Sir, can you hear me?" he called to Michael while scanning the road for the fastest route to the nearest hospital. Northwestern Memorial was 8 minutes away. He took surface streets and ignored a few traffic laws. Michael was unconscious but breathing. James could see his chest rising and falling, though it was shallow and rapid. His skin was gray and clammy, classic signs of cardiogenic shock. James grabbed his old stethoscope from the glove compartment and twisted around in his seat to listen to Michael's chest. The heart sounds were weak but regular, around 110 beats per minute. No obvious murmur, but the rhythm suggested the heart muscle was struggling. "This is going to be okay," James said aloud, though he wasn't sure if he was talking to Michael or himself. "We're going to get you help." He put the car in drive and began racing through the city streets toward Northwestern Memorial. His muscle memory from years of following ambulances serving him well. Red lights, stop signs, the speed limits, none of it mattered when someone was dying in his back seat. While driving, James kept talking to Michael, checking for responses, monitoring his breathing, and calling out his observations, a habit from years of giving radio reports to hospital staff during ambulance transports. Middle-aged male, probable myocardial infarction, conscious but unresponsive to verbal stimuli. Respirations shallow at approximately 24 per minute, skin pale and diaphoretic. Halfway to the hospital, Michael regained consciousness, gasping and clutching his chest. "What's happening to me?" he whispered, terror in his eyes. "You're having a heart attack," James said calmly, the clinical directness coming naturally after years of delivering difficult news. "But we're almost at the hospital and you're going to be fine." "A heart attack, but I'm only 52 inches. Age doesn't matter. What matters is getting you the right treatment quickly, and we're about 3 minutes from the best cardiac unit in the city." James's voice carried the kind of authoritative reassurance that only comes from years of managing medical emergencies. Michael, despite his pain and fear, found himself oddly comforted by his Uber driver's confidence and medical knowledge. "How do you know so much about ... Michael started to ask, then gasped as another wave of chest pain hit him. "Don't try to talk," James instructed, pulling into the hospital's emergency department ambulance bay. "Save your energy. Help is 30 seconds away." James parked directly in front of the Northwestern Memorial Emergency Department entrance, ignoring the signs that clearly stated authorized vehicles only. He threw on his hazard lights and ran around to the passenger side of the car. "I need help here," he called to the security guard who was approaching to tell him he couldn't park there. "Heart attack patient in my car." The security guard took one look at Michael, who was now semi-conscious and clearly in distress, and immediately radioed for a medical team. Within seconds, 2 nurses and a resident physician came running out, with a wheelchair and emergency equipment. As they began to transfer Michael from the car to the wheelchair, James found himself automatically slipping into the familiar role of giving a medical handoff report. 52-year-old male, sudden onset of chest pain and diaphoresis approximately 20 minutes ago, lost consciousness briefly, vital stable but he's showing signs of acute ME. James rattled off in the rapid, precise language that medical professionals use to communicate critical information quickly. The resident, Dr. Sarah Kim, looked up at James with surprise. The clinical accuracy and medical terminology weren't what she expected to hear from an Uber driver. "Are you a paramedic?" she asked while checking Michael's pulse and blood pressure. "Not exactly," James replied, then added, he was complaining of chest pain, became diaphoretic and pale, lost consciousness for about 3 minutes, heart rate around 110, respirations 24 and shallow. He hasn't eaten today and was under significant stress. Dr. Kim stared at James for a moment. The assessment was perfect, exactly the kind of report she would expect from an experienced emergency medical professional, not a rideshare driver. "Do you know?" she started to ask, but James was already backing away. "Take care of him," he said simply. "He's a good guy. Just needs to slow down a little." As the medical team rushed Michael into the emergency department, James stood alone next to his car in the ambulance bay, his hands shaking slightly as the adrenaline began to wear off. He had just done exactly what he'd sworn he would never do again, made life-and-death medical decisions for another human being, but this time was different. This time, everything had gone right. James sat in his car for 10 minutes, trying to process what had just happened. For 2 years, he had successfully avoided any situation that required him to use his medical training. He had convinced himself that he was happier as just a driver, that he didn't miss the responsibility and stress of practicing medicine. But tonight, when faced with a genuine medical emergency, all of his old skills had come rushing back. The assessment, the treatment decisions, The calm authority in a crisis, it had all felt as natural as breathing. More importantly, he had saved a life. For the first time in 3 years, he had used his medical knowledge to help someone, and it had worked exactly as it was supposed to. His phone buzzed with a notification from the Uber app, a new ride request, just a few blocks away. James stared at the screen, torn between returning to his normal routine and walking into that hospital to check on his patient. Before he could decide, Dr. Kim appeared at his car window. "Excuse me," she said, tapping on the glass. "Could I speak with you for a moment?" James rolled down the window, expecting to be told he needed to move his car from the ambulance bay. "Your passenger is going to be fine," Dr. Kim said. "We got him to the cardiac cath lab within 30 minutes of symptom onset, which is excellent timing. His heart attack was significant, but because you got him here so quickly and kept him stable during transport, his prognosis is very good." James felt a wave of relief wash over him. "That's great news. I need to ask you something," Dr. Kim continued. "Your assessment and report were perfect. Textbook perfect. Are you sure you're not a paramedic or EMT?" James hesitated. He had spent 2 years carefully avoiding this exact conversation. "I used to be a doctor," he said finally. "Emergency medicine. But that was a long time ago." Dr. Kim's eyes widened. "Used to be? What do you mean?" "I left medicine 3 years ago. Personal reasons. Now I drive for Uber, but you clearly haven't lost any of your skills. The way you handled that emergency tonight, you saved that man's life. Why aren't you practicing medicine anymore?" It was a question James had asked himself every day for 3 years, but hearing it from another emergency physician made it impossible to ignore. "It's complicated," he said. "I lost my confidence after a patient died, a case I should have handled better. I couldn't trust my judgment anymore, so I walked away." Dr. Kim studied his face for a moment. "Can I tell you something? I've been practicing emergency medicine for 8 years, and I still second-guess myself on difficult cases. Every good doctor does. The ones who don't are the dangerous ones." She paused, then continued. "What you did tonight was exactly what any of us would have done in the same situation. You made the right assessment, got him the right treatment, and kept him alive during transport. That's not luck, that's skill and experience." James didn't respond immediately. He was processing not just her words, but the realization that tonight, for the first time in 3 years, he had felt like himself again. "Our department is always looking for experienced emergency physicians," Dr. Kim said carefully. "If you ever decide you want to come back to medicine, I'd be happy to put you in touch with our director. Tonight proved that you haven't lost your touch." She handed him her business card and walked back into the hospital, leaving James alone with his thoughts and a decision he wasn't ready to make. 3 days later, James received an unexpected phone call. "Is this Jim, the Uber driver?" the voice asked. "Yes, this is James. This is Michael Chen. You drove me to Northwestern Memorial on Tuesday night." James immediately recognized the voice. "Michael, how are you feeling? Are you okay?" "I'm great, actually." "Well, as great as you can be 3 days after a heart attack," Michael said with a laugh. "They did an angioplasty and put in 2 stents. The doctor said I should make a full recovery." "That's wonderful news. Listen, I need to thank you. The cardiologist told me that getting to the hospital so quickly probably saved my life. He said another 10 or 15 minutes and the damage to my heart could have been permanent, maybe even fatal." James felt a familiar tightness in his chest, the same feeling he used to get when a patient thanked him for saving their life. "Anyone would have done the same thing," he said. "No, they wouldn't have," Michael replied firmly. "Most Uber drivers would have called 911 and waited for an ambulance. You knew exactly what to do and where to go. You stayed calm. You kept me calm, and you got me to the right place at exactly the right time." Michael paused, then continued. "The doctor at the hospital said you gave them a perfect medical report when we arrived. She said you talked like a doctor, not a driver. Are you a doctor?" James had been dreading this question for 3 days. "I was. I'm not anymore." "What do you mean? Did you lose your license or something?" "No, nothing like that. I just left medicine. Started driving instead." "But why? I mean, you clearly saved my life. You're obviously good at it." It was the same question Dr. Kim had asked, and James still didn't have a good answer. "It's complicated," he said finally. "Well, whatever your reasons, I'm grateful you were driving that night instead of practicing medicine somewhere else," Michael said, "because if you had been, I'd probably be dead right now." After they hung up, James sat in his apartment staring at Dr. Kim's business card. For 2 years he had convinced himself that he was done with medicine, that he was happier with the simpler life of an Uber driver. But Tuesday night had awakened something in him that he couldn't ignore. He had saved a life, not as part of a medical team in a well-equipped emergency room, but alone, with nothing but his knowledge, experience, and instincts, and it had felt like coming home. Over the next week, James found himself driving past Northwestern Memorial Hospital repeatedly. often taking routes that weren't the most efficient just so he could see the building where he had rediscovered his medical identity. His passenger reviews continued to be excellent, but he noticed that he was paying even more attention to his passengers' health status. A college student who seemed unusually pale got a gentle recommendation to see a doctor about possible anemia. An elderly woman with a persistent cough was advised to follow up with her physician about pneumonia. A businessman complaining of headaches was warned about the signs of hypertension. James realized he was practicing medicine again, just without the official title or hospital privileges. His Uber had become a mobile clinic where he provided health assessments, medical advice, and emergency transportation to people who might not otherwise have access to immediate medical care. The question was whether he was ready to make it official. Dr. Kim had called twice, leaving voicemails about potential opportunities at Northwestern Memorial. James had listened to both messages but hadn't called back. The idea of returning to medicine was simultaneously thrilling and terrifying. What if he froze up during a complex case? What if his confidence abandoned him when someone's life was on the line? What if another Emma Rodriguez walked into his emergency room? But then he remembered Michael Chen's words. If you had been practicing medicine somewhere else, I'd probably be dead right now. For the first time in 3 years, James began to consider the possibility that maybe, just maybe, the world needed him to be a doctor more than it needed him to be an Uber driver. On a Saturday morning in December, exactly 3 weeks after Michael Chen's heart attack, James walked into Northwestern Memorial Hospital wearing a suit instead of his usual Uber driving clothes. He carried a folder containing his old medical credentials, board certifications, and a letter of recommendation from his former chief of staff at Chicago General. Dr. Kim met him in the lobby, looking pleased but not entirely surprised. "I wondered when you'd call," she said, shaking his hand. "After what I saw that night, I knew you'd be back." "I'm not sure I'm ready," James admitted as they walked toward the elevator. "It's been 3 years. Medicine changes fast. Skills like yours don't disappear," Dr. Kim replied. "And we have excellent continuing education programs to get you up to speed on any new protocols or procedures." As they rode the elevator up to the administrative offices, James felt a familiar mixture of excitement and anxiety that he hadn't experienced since his residency days. The smell of the hospital, that distinctive combination of disinfectant, floor wax, and something indefinably medical brought back a flood of memories, both good and bad. "Can I ask you something?" Dr. Kim said as they stepped off the elevator. "What changed your mind? What made you decide to come back?" James thought about the question. There were many answers he could give Michael Chen's gratitude. The realization that he missed practicing medicine, the understanding that running away from his fears hadn't made them disappear. But the real answer was simpler than that. "I realized that being afraid of making a mistake isn't a good enough reason to stop helping people," he said. 3 years ago, I let one case define my entire career. Tuesday night reminded me that there were thousands of other cases where I made the decision, where I saved lives, where I made a difference. Dr. Kim nodded. "Every doctor has cases that haunt them. The key is learning from them without letting them destroy you. I think I'm finally ready to do that." 6 months later, Dr. James Martinez was back in his natural habitat, the emergency department of a major hospital, this time at Northwestern Memorial. He had completed his recredentialing process, updated his continuing medical education, and gradually worked his way back up to full-time emergency physician status. The transition hadn't been without challenges. There had been moments of doubt, cases that triggered his anxiety about making mistakes, nights when he questioned whether he had made the right decision in returning to medicine. But there had also been moments of pure satisfaction, successful codes, accurate diagnoses, grateful patients, and the deep fulfillment that comes from using your skills to help others in their most vulnerable moments. James still drove for Uber occasionally, usually just 1 or 2 shifts per week when he needed to clear his head or wanted to connect with regular people outside the medical world. But now his passengers got something even more valuable than a ride. They got access to one of the city's most experienced emergency physicians, who happened to be behind the wheel of their Uber. Michael Chen had become a regular passenger and eventually a friend. His recovery had been complete, and he had used his heart attack as a wake-up call to reduce his stress levels and improve his health. Every few months he would book James for a ride, just to catch up and express his gratitude for that night. In November, "You know," Michael said during one of these rides, "I think about that night all the time. Not the heart attack part, the part where you saved my life. Do you ever think about what would have happened if you hadn't been my driver that night?" James considered the question. "I think about it sometimes, but I also think about all the other nights, all the other passengers, all the other chances to help someone. That night wasn't an accident, it was just the most dramatic example of what I was supposed to be doing all along." "You mean practicing medicine?" "I mean helping people, whether that's in an emergency room or in an Uber, doesn't really matter. What matters is being ready when someone needs help." Michael smiled. "Well, I'm grateful you were ready when I needed help, and I'm grateful you decided to go back to being a doctor full-time. The world needs more physicians like you." As James dropped Michael off at his office building. He reflected on the journey that had brought him back to medicine. It had taken a heart attack in the backseat of his Uber to remind him who he really was, not just a driver, not just a former doctor, but a physician whose calling was to help people regardless of the setting. The stethoscope was no longer hidden in his glove compartment. It was back around his neck, where it belonged. The story of Dr. James Martinez reminds us that our true calling doesn't disappear just because we walk away from it. Sometimes it takes an unexpected moment, a medical emergency in the backseat of an Uber, a chance to use skills we thought we'd abandoned to show us who we really are. For 3 years, James had convinced himself that he was happier as a driver than as a doctor. But when Michael Chen's life hung in the balance, all of his medical training, experience, and instincts came rushing back. He realized that he hadn't stopped being a doctor when he left the hospital. He had just been practicing medicine in a different setting. James's journey also illustrates the importance of not letting our worst moments define our entire careers. Every physician has cases that don't go as planned, patients who can't be saved, decisions that lead to regret. The challenge is learning from these experiences without allowing them to paralyze us or prevent us from continuing to help others. In the end, James discovered that running away from his fears hadn't made them disappear. It had just delayed the inevitable confrontation with who he was meant to be. When he finally stopped running and faced his calling again, he found that his skills were intact, his compassion was stronger than ever, and his ability to help others had never really left him. The passengers who complained about their Uber driver taking routes past hospitals had no idea they were being driven by one of the city's finest emergency physicians. They couldn't have known that his medical knowledge.com demeanor and instinctive understanding of health issues weren't just personality quirks. They were the result of 15 years of intensive medical training and experience. Today, Dr. James Martinez continues to practice emergency medicine, using his second chance to help even more people than before. His experience as an Uber driver taught him valuable lessons about connecting with patients as people, not just medical cases. His time away from medicine gave him perspective on what really matters in healthcare, not perfect outcomes, but compassionate care and the willingness to help when help is needed. And sometimes, late at night when his shift at the hospital is over, James still drives for Uber not because he needs the money, but because he never knows when someone might need a doctor, even if they think they're just getting a ride. Have you ever met someone like Dr. James Martinez? Someone whose hidden expertise emerged in a moment of crisis, someone who found their way back to their true calling after walking away? Share their story in the comments below, and let us know what city you're watching from. Here at Forgotten Voices, we believe that our most important talents have a way of revealing themselves when they're needed most. If this story moved you, subscribe and share it. Help us ensure that stories of second chances and rediscovered purpose continue to inspire others to embrace their calling. We'll see you in the next story. Until then, remember that the person sitting next to you might be carrying skills and experiences you never imagined. Sometimes the most qualified person to help you isn't wearing a uniform or sitting behind a desk. Sometimes they're just driving the car.